Hello, my dear students and colleagues. Today, I want to focus on how to make record forensic medicine record on age estimation report. Age estimation we are doing in certain medico legally important ages. For example, age 5 years, 7 years, 12 years, 14 and 16, 18, 21, and more than 21. These are the medico legally important ages. For example, railway accidents or railway cases, even 5 years of age is important. Criminally responsible ages are 7, 12, 18, and 20, 21, more than 21. Criminally responsible ages. Child labor, 14 years is important age for 14, 15, 18. That is a age of importance of employment, where he can work, where he cannot work, like that. 14, 15, and 18 of acquiring driving license or right for vote, all those things related to 18. Even for right for marriage for girls 18, for boys 21 in India till now. So once we attain 18, he will be, after completion of 18 years, he can be considered as major. Minor below 21, 18 years. Sometimes even 21 years also important. When a girl is under the guardianship of court, she will attain majority only after completion of 21 years. After 21 years only, anybody can obtain, purchase alcohol in India after completion of 21 years. Legal age for purchase of alcohol. So these are the medical legally important ages. Anywhere there is a theft or sexual offense or road traffic accidents or unlicensed boy is driving a vehicle, is involved in a crime, the such case, police will bring the such child or individual to the medical legal expert or casualty for age determination. After receiving the equation from a proper authority, we'll start examining after obtaining consent from the individual. If the suspected individual is a minor, he always will better take consent from guardian also. For example, in where there is a crime is involved, in such a case, we can obtain consent by applying reasonable force. By this preliminary data, we can start examining the individual. Even the individual may be under the influence of alcohol, so it is better take consent from guardian or some accompanying person or from parents. Next, age can be determined in three parameters. That is chronological age. We are not assessing mental age, we are assessing chronological age, bone age, teeth age, and physical growth age. So, external appearance and development of secondary sexual characters and graying of hair and all those things we are considering while fixing the age of the individual. Next, teeth. Teeth eruption. We are considering eruption of deciduous teeth and permanent teeth and mixed dentition while assessing the age of the individual. If necessary, we will take the radiograph of teeth, orthopanticogram, or sometimes calcification of the roots also. We can take consideration for assessing the age, not only eruption and calcification of the teeth. Next, coming to the appearance and fusion of various ossification centers. In this video, I want to emphasize only three joints. Only these are elbow joint, wrist joint, and hip joint, pelvis. These are the three we can focus. Then external appearance, development of secondary sexual characters, and development of genitalia and various body hairs, axillary, pubic, facial hairs, and their texture and graying of hairs also we can consider in advanced ages. First, coming to the attaining puberty and menarche. Also, we can consider they are attaining menarche in case of female. Even boy also. Genital development, we can see development of nipple, breast, areola. All these things we can consider for assessing the age of the individual, especially in female. Next, coming to the eruption of teeth. Deciduous teeth usually erupt by 6 months to 30 months. That means half a year to 2.5 years. Within 2.5 years, all the deciduous teeth, 5 in each quadrant, 20 overall. All the 20 teeth will erupt by 2.5 years. It will persist up to 12 years. Permanent teeth will start erupting by 6th year. Before 6 years, there is no deciduous teeth. Sorry. Before 6 years, there is no permanent teeth. After 12 years, there will be no deciduous teeth. Though 6 to 12 is age of mixed dentition. Then, permanent teeth are important for assessing the age of the individual. 6 to 7 years, lower incisors and upper incisors will erupt. Central incisors 6 to 7 years, lateral incisors 7 to 9 years, canine 9 to 10 in lower jaw and 10 to 11 or 11 to 12 in upper jaw, a little bit delayed. First premolar erupts by 9 to 10 years, second premolar 10 to 12 years, first permanent molar erupts by 6 years, 6 to 7 years, second permanent molar 12 to 14 years, third molar 17 to 25 years. Simply, if you remember the rule of 6, you can easily understand the eruption of permanent teeth. 1 or 2 years difference may be present according to the ethnicity, genetic origin, and then environmental and dietary factors on eruption and calcification of teeth. It will vary to place, region to region, country to country, ethnicity, all those things. So this video is not meant for expert opinion. This is only for basic guidelines for how to record forensic medicine record for beginners, MBBS students or law students or forensic science students. This is the guidelines only. Next, age of mixed dentition is 6 to 12 years. After 25 years, there may not be any much difference in eruption of teeth. After 25 years, we can consider the attrition and other degenerative changes in teeth that can be better considered as Gustafson's methods for assessing of age by dental changes. Next, ossification centers. Ossification centers, already told, I am focusing only 3 joints. Lower end of humerus, and upper end of radius ulna in elbow joint. Lower end of humerus contains four centers from medial to lateral: medial epicondyle, capitulum, trochlea, and lateral epicondyle. Sorry, medial epicondyle, trochlea, capitulum, and lateral epicondyle. From medial to lateral. Trochlea appears, center for trochlea appears by 9 years. Center for medial epicondyle appears by 7 years. Center for capitulum appears by 1 year. Center for lateral epicondyle appears by 11 years. 1, 9, 7, 11. These are the mnemonics. Trochlea articulates with the olecranon process of the ulna, so it will appears by 9 years. Tip of the olecranon process appears by 9 years. Upper end of the ulna articulates with the trochlea. Upper end of radius articulates with the capitulum. Upper end of the radius appears by 5 years, 5 to 6 years. All the centers will fuse by 16 years or 17 years. All the centers. Here there is a logic. Among the four centers of the lower end of the humerus, three centers unite first, forming conjoint epiphysis. Lateral epicondyle, capitulum, and trochlea unites first at the age of 12 years, forming conjoint epiphysis. This conjoint epiphysis fuses among themselves by 14 years. These, after 14 years, this conjoint epiphysis fuses with the shaft by 16 years, whereas medial epicondyle forms a separate epiphysis. It directly unites with the shaft by 16 years. Anyhow, lower end of the humerus, all the centers fuses with the shaft by 16 years, whereas upper end of ulna, upper end of radius, fuses with the shaft by 17 years. Anyhow, all the centers around, in and around elbow joint will fuse by 17 years. All the joints are not fused means definitely the person is a minor, not completed 18 years, not even completed 17 years. So this is a guideline. So wherever we are assessing a person is a minor or major, you have to look into the ulna. Of the centers are appeared but not fused means he is minor. At the same time, you have to see that dentition also. In any quadrant, third molar hasn't erupted means the age is below 17. The second permanent molar erupts by 14 years, 12 to 14 years. After 14 years, the mandible will grow to accommodate the space for the third molar. The space will form between 14 to 17 years behind second molar. If there is no space formed anywhere behind second molar means the age can be only 14 years. The age, space is formed but nowhere third molar is erupted means the age is below 18 years. He is minor. Based on these things, we can say that he is minor. Next, coming to the wrist joint. Wrist joint formed by lower end of radius ulna and carpal bones. We can consider some of the metacarpal bones also for age estimation. Carpal bones are 8. She looks too pretty. Try to catch her. This is the mnemonics to memorize carpal bones. Proximal row is scaphoid, lunate, triquetrum, and pisiform. Distal row is trapezium, trapezoid, capitate, hamate. Lower end of radius and ulna, lower end of the radius appears by 6 years, 5 to 6 years. Lower end of radius appears by 2 years. The fusion by 18 to 19 years. Carpal bones. Biggest carpal bone is capitate and hamate. These two bones will appear earliest. So within 1 year, these two carpal bones will appear. Third year, try for three. Third year, triquetrum will appear. Then lunate. So by 4 years, only four carpal bones. 5 to 7 years, there are remaining three carpal bones will appear. At the age of 7 years, there are seven carpal bones. Until 10 years, only seven carpal bones. At the age of 10th year, the pisiform will appear as a small opaque point at the area distal to ulnar styloid process. A opaque small dot, it is center for pisiform, appears by 10th year. Prominently, it will become prominent by 11 to 12 years. So the well formed pisiform we can expect by 12 years. If pisiform hasn't appeared anything, means even a white dot form, you can say that the individual's age is below 10 years. The medico legally important age for 12. At the age of 12, a boy can give consent for a simple medical examination. In such case, criminally responsible age also 7 to 12 years, based on his mental maturity, he is responsible. After 12 years, any juvenile with conflict with law can be sent for juvenile court. So these are the importance of age of 12. So PC form will decide he is below 12 years or above 12 years. Next, 14 years. At the age of 14 years, what are the changes are going to happen? Coming to the first metacarpal bone. First metacarpal bone is having some peculiarity than other metacarpal bones. The center for first metacarpal bone appear at proximal end, but fuses before at the age of 15 years. Base of the first metacarpal bone, it is proximal part, appears somewhere but fuses by 15 years. So the base of the first metacarpal bone hasn't fused, means below age is below 15 years. The rest of the metacarpal bones fuses by 17 years. First metacarpal bone fused, but other remaining metacarpal bones hasn't fused. That means age completed 15 years, but not beyond 17 years. So this is the rough idea about how to interpret the ossification centers around wrist joint. Next, coming to the hip bone. Hip bone, even 6 years, there is a major change will occur in ischiopubic ramus. Ischium and pubic ramus are separated. They will unite only at the age of 6 years. A continuous ischiopubic ramus will form by 6 years. Next, at the age of 12 years, lesser trochanter for the femur. Lesser trochanter of femur will appear by 4 years. Greater trochanter appear by 4 years. Lesser trochanter 12 years. Triradiate cartilage. The cartilage attains Y shape. That is Y shape. That's why the name is triradiate. The cartilage may be present before 13 years, but what is happening at the age of 13 years? It attains Y shape by 13th year. At the age of 15 years, even Y shape cartilage will disappear. The iliac bone, the pelvis bone will appear as a continuous. Until then, it appears as a union of three bones. After 15 years, you cannot differentiate ischium, pubis, and ramus. Ischium, pubis, and ilium. Three bones will unite. No visibility of triradiate cartilage after 15 years. What is happening at the age of 14 years? Iliac crest will appear by 14 years. Ischal tuberosity, center for ischal tuberosity, appears by 16 years. This iliac crest and ischal tuberosity will unite by 19 to 21 years. This is the rough idea about hip joint ossification centers. Every medical student should be familiar with these are the points. At least these are the basic things. Based on this, you can assess the individual is a minor or major, completed 18 years or below the 18 years. So medical legally important ages. So you can sometimes medial end of the clavicle will unite by 21 years. All the centers usually in the body will unite by 21 years. Based on this knowledge, you can opine the individual has attained above certain age and below certain age. Is a minor or major. He is eligible for child labor or not eligible. I want to say something about child labor. After completion of 14 years, any boy can work in non-hazardous work until 18 years. After completion of 18 years, he can work even hazardous work in even night duties. This is the importance of age. After completion of 18 years only, any girl can give a valid consent for participating sexual intercourse. Even she can give consent before 18 years, but is invalid. Otherwise, it is called as statutory rape. Thank you. Thank you, my dear students. Continue for medical education. Thank you.